Hello, my name is Fiona, and I am a certified teacher and a Praxis coach with Study.com. Are you planning to take the psychology exam? This is Praxis test code 5391. This problem set covers the category of methods, development, states of consciousness, and disorders. To be successful, you will need a solid understanding of the foundational concepts that underpin the field of psychology. Let's review the types of questions you can expect to encounter on the exam. Problem number 1. A 12-year-old student is experiencing persistent feelings of anxiety, hopelessness, and social withdrawal. Which of the following types of atypical development would most likely be assessed when they visit a mental health professional? Emotional development, anatomical development, cognitive development, or physical development. Anatomical development pertains to body structure and is unrelated to the emotional symptoms described. So we can eliminate that. Cognitive development involves mental processes, not emotional states. So we can eliminate that one as well. Physical development refers to bodily growth and is unrelated to emotional issues as well, so that's not applicable either. The correct type to be assessed is emotional development. A mental health professional would focus on emotional development to understand and address the student's anxiety, hopelessness, and social withdrawal. Therefore, the correct answer is emotional development. Problem number 2. A psychologist is treating a patient with a social phobia. If the therapist chooses a behavioral approach for treatment in the case, which of the following strategies would the therapist most likely choose? Exposing the client incrementally to harmless social situations, challenge the client's irrational thinking patterns, use of hypnosis to address childhood trauma, or listening without judgment and restating the client's troubling thoughts. Challenging irrational thinking patterns is a cognitive approach, not behavioral. So let's cross that out. Using hypnosis to address childhood trauma involves psychodynamic methods, not behavioral therapy. So we can cross that one out as well. Listening without judgment and restating thoughts is a humanistic approach, focusing on empathy rather than behavior change. So let's eliminate that as well. The correct answer is exposing the client incrementally to harmless social situations. This strategy, known as systematic desensitization or exposure therapy, is a core component of behavioral therapy, aimed at reducing fear responses through gradual exposure to the feared stimuli. Therefore, A is the correct answer here. Problem number 3. All of the following are types of individual psychological therapy except electroconvulsive therapy, ECT, behavioral therapy, psychodynamic approach, or cognitive therapy. All of the following are types of individual psychological therapy except ECT. Behavioral therapy changes maladaptive behaviors through conditioning techniques. The psychodynamic approach explores unconscious processes and early life experiences. Cognitive therapy changes negative thought patterns to improve emotional regulation and coping strategies. In contrast, ECT is a medical procedure involving electrical brain stimulation to treat severe mental health conditions like major depression or bipolar disorder. Therefore, the correct answer here is ECT. Problem number 4. A student bullies their classmates and tends to manipulate others for their personal gain with no remorse for their actions. Which of the following type of personality disorders does the student most likely have? Narcissistic, histrionic, antisocial, or borderline? Narcissistic personality disorder involves an inflated sense of self-importance and need for admiration, but not necessarily bullying or manipulation without remorse. So let's cross that out. Histrionic personality disorder is marked by excessive emotionality and attention-seeking, which is not described here either. So we can eliminate that as well. Borderline personality disorder involves instability in relationships, self-image, and emotions, often with fear of abandonment and impulsivity, but not manipulative or remorseless bullying. So let's cross that out. The correct answer here is antisocial personality disorder, characterized by the disregard for others' rights, manipulative behavior, lack of remorse, and often engaging in deceitful or aggressive actions for personal gain. Therefore, the correct answer here is antisocial personality disorder. I trust I was able to clarify the types of questions that you will find on the Praxis 5391 Psychology Exam. Please remember to like and subscribe to this channel so that with Study.com's help, you will feel confident and prepared on exam day. Bye for now.